customary, is County Executive Armin Budish. We also have Dr. Heidi Gullett with us today to provide our customary data roundup. And we have a special guest today, actually the very first preventive medicine resident that came to work with us 10 years ago here at the Board of Health, Dr. Johnny Rose, to talk about some interesting data that he's been working on that sort of helps us understand a bit of an eye into the future on our trending. He'll talk about some of that important data as well. So with that, I wanted to pause and allow Executive Budish to start us off as he usually does. Armin?
Morning. As always, it's a pleasure to be with everyone here today. I'd like to thank Terry Allen and Dr. Heidi Gullett and all the staff here at the Board of Health for the great work they continue to do on all of our behalf. And I want to thank the person who's the Dr. Heidi Gullett of Ohio, Dr. Amy Acton, who announced her resignation yesterday. The governor put it very well when he said that not all heroes wear capes. Some wear white coats. I firmly believe that there would be many, many more dead in Ohio if it were not for the wisdom, the expertise, and the courage that Dr. Acton demonstrated throughout these past few months. I have been, and in fact all of us have been beneficiaries of her steady presence and her encouragement as we all made monumental changes to our lives. So I want to thank Dr. Acton from the bottom of my heart for her great work. I'd like to continue to talk about racial inequity and the protests that have engulfed our country and the world. I spoke about this last week, but this has to be an ongoing conversation. People want more than words. They want substantive change. As I said last week, the county works hard to address issues of racial inequity in the way that we deliver services and in the development of programs and services that we offer. For example, we were a founding participant in First Year Cleveland to attack the horrific rates of infant mortality, especially in our minority community. We've helped expand COVID-19 testing, especially in underserved and minority areas. We've created a small business stabilization fund focused on low and moderate income communities with significant minority populations. And we've done a lot more, but we need to do even more. So today I want to say I'm recommending to Council 15 local civic and business leaders for appointment to the Cuyahoga County Citizens Advisory Council on Equity. This council was formed through legislation introduced by County Council members Dale Miller and Yvonne Conwell. I'm recommending that these leaders come together to review the full range of equity issues that exist in Cuyahoga County, to make sure that we're being fair and inclusive. And if changes are required in the way we do things, I'll ask that they give us specific recommendations. I look forward to working with them. Separately, and starting with our Health and Human Services group, we're initiating a collaborative and internal staff-led group to look at the impact of our county services and programs on people today, people of color. I expect that group to develop and track measures that'll provide us with a data-informed approach. We'll make changes to our programs if and when we see unexpected negative outcomes. And we're doing more. There's been an outcry across the country to defund police. Now, what does that mean? If you listen to the people calling out for this, it actually can mean a whole lot of different things. But one of the key points consistently raised is that police are performing some duties that might be better done by social workers or human service professionals. We've been planning this exact approach already, even before the protests, and without defunding our law enforcement. We recently sent out an RFP, a request for proposals, for creation of a diversion center. Our diversion center will be both a physical space and a new approach. Instead of arresting someone who has mental health challenges or drug and addiction problems, we want to redirect them into the diversion center where they can be stabilized, treated to get better, and given resources like job training to become a productive member of our community. We've spent months planning this and reaching out to places that have similar approaches in place around the country. And I can tell you there aren't a lot of similar programs. So I'm proud that we will be one of the first in the country to stand up a diversion center, helping and healing people instead of arresting and incarcerating them. Of course, some people will still end up in jail. And we take the health of our inmates very seriously, and the health of our staff there very seriously. From the very beginning of the COVID crisis, we knew that any congregate setting, whether it was a homeless shelter, a group home, or our jail, any congregate setting was in real danger of seeing rapid and uncontrolled spread of the virus. So working with Metro Health, we stood up an aggressive testing and containment strategy at the jail. And I'm pleased to say that we are doing great. Our jail is far outperforming other jails and prisons in Ohio and around the country. Ohio has had 4,769 confirmed COVID cases in its prison system, the third highest in the country, just behind Texas and the federal prison system. There have been at least 496 deaths from coronavirus reported among prisoners. In fact, Ohio has the highest number of prison deaths in the country. Take a look at some other facilities. The Morrow County Correctional Facility, a 126-bed jail in Ohio, recently had 100% of its inmates test positive for COVID-19. That's 126 positives out of 126 prisoners. Acton Federal Prison had 525 positives out of about 2,000 prisoners. In the Cuyahoga County Jail yesterday, we had 2 cases of COVID, 2 cases out of about 1,100 current prisoners. 2 out of 1,100, that's about, well, it's not a lot, put it that way. Small percentage. That's amazing, and it's a real testament to our jail staff and Metro Health for the awesome job they're doing there. Having a plan in place and being prepared as we were has definitely saved lives. And the judges and prosecutors have really made the difference. By reducing the jail population, they've created the space necessary in our facility to isolate and protect prisoners. Finally, I want to switch gears and announce that the county has put before the county council the rent relief program. We know that the economic fallout of the COVID crisis has been devastating, and we've created many new programs to address that, from small business loans to our virtual job fairs and more. Recently, the U.S. Census Bureau did a survey showing that over 21% of Ohio residents are currently unable to make their monthly housing payment. That's 21%, that's 1 in 5 can't make their rent payments. Locally, our unemployment rate has skyrocketed to more than 23% in April. People who aren't working are going to have an impossible time paying their rent. CNBC and other news outlets have warned of a tsunami of evictions coming. Evictions generally were halted in April and May, but they're starting up again, and this could be a disaster. So we're working with the City of Cleveland, Cleveland Heights, East Cleveland, Euclid, Lakewood, and Parma to create a uniform county-wide system for emergency rental assistance to prevent people losing their homes and ending up homeless. I've recommended to council that we provide $5 million of our corona relief funds that come from the federal government and $1.8 million of our community development block grant funds from the U.S. Department of Housing and Urban Development for rent relief. This $6.8 million will be provided to income-eligible applicants for up to 3 months of back rent. The checks will be made out to their landlords, which should not only help renters by keeping them in their homes, but this program should also stem the economic disaster that could hurt building owners, the landlords. The Cleveland Housing Network will be ready for applications on July 1st, but anyone who needs assistance now should call 211. Call now and get in line. We want to keep people in their homes, in their apartments. We're doing everything we can to get our residents through this coronavirus economic crisis. Thank you.
Thank you, Executive Budish, for your commitment, continued commitment to address equity as we move through what have been devastating economic impacts on the lives of many people here in Cuyahoga County and around the state, helping them, given the resources of the county and the expertise of the county, to help to try to make the management a bit better for everyone and to support them. We appreciate that, and that certainly is has important public health consequences for everyone in our community. So we know that Governor DeWine announced that everyone who would like a test for COVID can now get one. Anyone, I should say. Whether you have symptoms or not, you can visit a community health center, a testing location, or a pharmacy to receive one. Talk with your primary care doctor about the options for testing. At coronavirus.ohio.gov, there's an interactive statewide map which lists the places where you can get tested by county. I know also that there'll be further resources locally to assist you in identifying those places going forward. Be sure to read the information on the specific requirements for each testing location. Some locations require an appointment, some insurance information, and other guidance required. So please check them out and call ahead before you consider getting a test. The governor also mentioned that the National Guard will be conducting pop-up testing sites in areas where residents may have limited access to testing locations. This work would complement the related work that County Executive Budish has paid for with the collaboration with Metro Health and the Board of Health, testing in the community to support areas that don't have access as well. So we're seeing an increase in testing being made more widely available, which is welcome to everyone. The governor listed Cleveland and Akron among the cities that will be hosting these pop-up sites at some point in the near future. This news represents a big step forward to expand access across the state. And I know that all our partners at the state level have been working hard to expand testing capacity, and we appreciate their commitment to serve Ohioans. Even as we work hard locally, we know our partners at the state level have been putting in a lot of hours as well, and we really appreciate their collaboration throughout this and their commitment to serve the good of the public. Of course, as Executive Budish noted, we were very surprised and with regret that we heard that Dr. Acton was leaving her post as the state health director. She was on the job for 18 months, and her contributions to the well-being of Ohio citizens will take years to be fully measured and appreciated. Those of us in public health are grateful to Governor DeWine for his ongoing dedication to public health in Ohio and his selection of Dr. Acton as the state's health director, which was clear evidence of that commitment. By relying on both long-standing public health practices and maintaining data-driven approaches based on science and proven public health practices, Dr. Acton led us from the early days in February, when there was so many unknowns, to where we are today, responding in earnest to a global pandemic and doing everything we can to protect the people of Ohio. Her decisive actions in the early stages of the pandemic undoubtedly saved thousands of lives and prevented many people from illness and suffering. She shared the hard truths about the shared sacrifices which were required from all of us. She delivered these messages with a strength and compassion that came from the hardship of her lived experience. The average tenure of a state health officer is 2 years across the country. Dr. Acton gave a lifetime of service to Ohioans in 5 months during a period which seemed like 5 years to all of us. She was the right person for the job at exactly the right time. We're extremely grateful for her service and look forward to working with her in her new role with Governor DeWine. With that, I'd like to transition to Dr. Gullett that will take us through the data roundup.
Good morning. I'd like to thank all of our media partners who continue to come so regularly from when we had 3 times a week to twice a week, now to weekly. We're just forever grateful for your support and your partnership in ensuring that our community has all the information they need on the impact of COVID-19 everywhere here locally. I also want to acknowledge that I see many of you out reporting and videoing our testing sites and other places during the week, and so I just want to acknowledge that sacrifice that you all continue to make even during the most intense times of this pandemic over the last few months, so thank you for that. I'd also like, in my moment of gratitude this morning, to echo the comments of my colleagues this morning about Dr. Acton. Your strong leadership, calm, and encouraging presence have been really powerful for all of us, particularly those of us on the front lines in local public health across the state of Ohio and actually across the country. Your swift and decisive action has really protected all of us and given us the guidance that we needed where there was no playbook. And I find it quite fitting that you have been recognized nationally for your leadership. We will be forever grateful, I personally am as well at the local level, for all you have done. I've been honored to be on your team this whole time, and it's very clear that your leadership has protected us and prevented significant loss of life in this state. I thank you for your service, for your sacrifices, for the sacrifices of your family so that you could do this job over the last few months in particular. And as another female physician and a fellow mom, I thank you very much. I've told Dr. Acton this a few times, but it's really inspiring to see what you have done for our community and for our state, and I will be forever grateful for that. I will now pause a moment to allow the cameras to swing over to the slides, and then I will transition to Dr. Rose. I got 4 thumbs up. So. All right, our cases today in the CCBH jurisdiction are lab confirmed 3,082, probable 612, with total case count of 3,694. Date of illness onset extends from February 28th to June 9th, and our recovered cases stand this morning at 1,441. The number of identified contacts is 6,020. The average age has stayed steady for us as we have a very wide range, and we have so for some time, 1 week to 102 years of age. And our median age has actually been stable for a while at 51 years of age for all cases. The sex of our cases, the breakdown is 57.5% female and 42.5% male, which has also been relatively stable. Our hospitalizations are at 573. We've had 571 adult hospitalizations and 2 pediatric, but I did want to clarify that those age ranges are from age 0 to 19 for those 2 hospitalizations that are considered pediatric. For intensive care unit admissions, we are at 156, and those are all adult admissions, so people 20 years and older. We have had 0 pediatric admissions to the intensive care unit related to COVID-19, although recognize that we have had some intensive care unit admissions of individuals in their 20s. This is our cumulative count, and it has yet another week added to it. We're just trying to provide multiple ways for the public to understand the impact of this infection in our community as time goes on, as months that maybe seem like years extend on. This is going to be with us for a while, so it's important to understand what this looks like as it evolves. So our total cases are again in red, and you see the continued rise from early March. And then in blue, we have the total recovered cases, and this continues to be cause for immense celebration within our team here. We're so happy that so many people in our community have recovered, but we continue to fight to ensure everyone has what they need during this time when so many people still remain vulnerable to the infection. The total number of deaths are in green, and you continue to see the rise since we had the first death in our community March the 20th. The next slide has been shown now several weeks, and you'll see that we have had a decrease in the number of week-to-week cases. So we presented this at the request of many of our media partners to better understand from week to week how many new cases were occurring or being diagnosed, and how does that compare with recoveries and with the number of deaths. So I reported 2 Fridays ago that we had a significant increase weekly increase in the number of cases, and we remained again higher last week than it was the second highest weekly total we'd had since the beginning. But this week we had 266 new cases since the in our community. Many people remain susceptible or at risk for this infection. Hand washing, frequently cleaning surfaces that are often touched, and being thoughtful about how we gather together in a safe way until we have enough immunity in the community to ensure we're safe. So even though you see infections go down, until we have a vaccine that protects a large proportion of us, we must remain vigilant, because there's a chance that these cases can continue to go back, and they most likely will in the fall as flu comes around. This graph, and then at the bottom, shows the newly recovered cases and deaths just week to week, as we have continued to show before, and we continue to be able to have more recovered cases each week, and that's very encouraging. So the number of healthcare workers has remained in the low 20%. This is up just slightly from last week, but that is pretty similar to prior weeks. Our unknown status has gone down a little bit. We continue to seek all information we can to better understand where transmission is occurring, and we're particularly concerned about our healthcare workforce, although I want to acknowledge we are concerned about every workforce in our community. It's simply that our healthcare workforce has had the highest exposures, and we have been so grateful for the personal protective equipment that our county executive and his team have ensured is available to our entire community. Pre-existing conditions for all cases are about 44%. So about 44% of our cases have one of those conditions that makes you at higher risk for complications. So again, those are things like diabetes, heart disease and lung disease, cancer, and other conditions that affect the immune system. The racial and ethnic breakdown for our cases is written out here by percent, and then you will see the graph representations of these numbers on the next slide. The cases identify as Asian at 1.8% of our cases, Black at 41.2%, white 45.1%, those identify as other 4.3%, and I'm pleased that our team continues to work very hard to gather this information, and the unknowns are down to 7.6%. For ethnicity, 2.5% of our cases identify as Hispanic, Latino, or Latina. 77.7% identify as non-Hispanic or non-Latino or non-Latina. And just under 20% remain unknown, but that continues to improve as we continue to seek that information. This is the same information as I mentioned in graph form, and again, all of these data will be available for you on our website shortly after our press conference. Our recovered cases and breakdown of the racial and ethnic breakdown is here. You'll see on our recovered cases, and again, as I always say, these numbers are slightly lower than what I report out at the beginning because I pull those numbers right before the press conference, as opposed to these numbers, which our wonderful data analytics team pool on Wednesdays so that they can have time to do these analyses to present to you. So they're a little bit lower, but for the cases that are recovered from this analysis, half identify as white, 38% is Black, 4% is other, and 3% is Asian. For ethnicity, 82% identify as non-Hispanic, non-Latino, or non-Latina, and 3% as Hispanic, Latino, or Latina. For hospitalizations, and the next slide is the intensive care unit breakdown by race and ethnicity, which I have been presenting for a number of weeks. 49% of all cases who are hospitalized at any point during their illness identify as Black, 42% is white, 5% as other, and 2% is Asian. For ethnicity, 83% identify as non-Hispanic or non-Latino or non-Latina, and 3% as Hispanic, Latino, or Latina. And for intensive care unit admissions, 51% of those individuals identify as Black, 42% is white, 4% as other, and 3% is Asian. And 85% of individuals identify as non-Hispanic, non-Latino, or non-Latina, and a very small percent as Hispanic, Latino, or Latina. And it is a very small number, which is why I'm not giving you the exact number to protect privacy. So, as I have mentioned at every press conference since this started, the toll on our community with regard to fatalities would have been much worse had decisive action not been taken at the state level by Dr. Acton and Governor DeWine. But the loss of life is still quite devastating, and every single one of these individuals is a member of our community who has been lost, and they have a grieving family. And so we continue to remember all of you and to support you as best we can during this time. I also want to acknowledge the significant impact this has had on our elder community with our median age, which I'll present in a minute, remaining in the 80s for loss of life. So recognize that these numbers are not data points, they are people. So our total deaths in our jurisdiction are 242, with 225 of those being lab-confirmed cases, and 17 being probable cases, who are individuals who have verified exposure to a lab-confirmed case. So these are not individuals who had a respiratory death that were never tested and could have possibly had COVID. These are individuals who died after an exposure which was verified through lab confirmation. The dates of these deaths are March 20th through June 12th, so as recent as a little after midnight this morning. The age range for the deaths in our community is 36 to 101, and as I already mentioned, the median age remains at 81 years of age, and 54.5% identified as female and 45.5% as male. The racial and ethnic breakdown for those who have died from COVID in our community is here with the graph to follow. 0.9% of our deaths identify as Asian, 27.7% is Black, 69.4% is white, 0.4% identify as other, and 1.7% is unknown, which again, you'll notice if you've been following us, that number has significantly dropped, but we won't stop until we have this information for everyone. Ethnicity, 0.4% of our cases identify as Hispanic or Latino or Latina, and 96.6% is non-Hispanic, non-Latino or non-Latina, and we are at 3% of unknown ethnicity. This is the same information in graph form, and this again will be available on our website. So this is our flatten the curve, and I'm very pleased that Dr. Rose is here to join us today. He has been an invaluable member of our team. I've had the privilege of working with him for over a decade, but he will present some more curves with modeling here in a little bit, but this is just a reminder of exactly what we have attempted to do over the last few months in flattening the curve. So this is our epi curve that you have seen previously. This is the additional week added. You'll see cases in red and recovered cases in blue. There was some press coverage yesterday of cases that seemed earlier than the first diagnosed cases here. And you'll notice that for quite some time we've been reporting date of illness onset prior to the first diagnosis in early March here. This is all based on cases that we've identified and interviewed. This is our weekly update to our combined map for cases in the city of Cleveland and in the other Cuyahoga County municipalities that are covered under our jurisdiction. This is, again, the location of where cases identify as living. Currently, this is not necessarily where transmission occurred. And you'll notice that the map continues to darken in many zip codes in our county, which is indicative of increased number of cases. And hospital utilization information. So for Cuyahoga County, medical surgical adult beds are slightly increased at 1% utilization, meaning we're at 77% of the beds we have available as a community are being used. This does not include the surge capacity beds that could be available should we have a surge in our community. There's a lot of preparation that's gone into that. These are simply the beds that are available right now. Those are physical beds, and those also relate to staffing availability. Pediatric medical surgical beds are 57% utilization, which has increased 1%. And again, I've talked about the increase in pediatric utilization over a few weeks, but we don't feel that that's reflective of COVID-19 acute infection because we've only had 2 hospitalizations in people 19 and under the entire time we've had this pandemic in our community. And critical care adult beds, we have 78% utilization, which is up 6% from last week. And ventilator utilization is at 33%, which is an increase of 1% from last week. And the number of ventilators has remained stable during that period of time. This is the graphical representation of what I've shared, but goes back to when we were first able to obtain this information in March. And you'll see in blue the adult medical beds with that sort of relatively stable, slight rise over the last month or so. And then critical care adult beds are in gray. So those are the adults are the two highest utilizations of the top lines. In orange, you'll see that pediatric medical beds, and you see that rise. And then again, ventilators have been pretty stable, with the exception of the early April rise in the utilization of ventilators that we saw previously. And remember that these numbers reflect also people who are hospitalized now for post-surgical indications, now that our hospitals have opened back up to elective procedures, and they can be things that require a hospitalization following those procedures. Those are reflected here. So this is not simply a reflection of COVID-19. So I just want to make sure that everyone recognizes that context for our hospitals opening back up to their full scope of services. So I've been presenting testing information for a number of weeks, and this represents the 3 hospital labs in our community in aggregate or in total. And this only represents PCR testing, meaning the kind of test we do to see if you have active virus going on or an active infection. This does not reflect the blood test or the antibody test, also known as a serology, that many people have been getting. I'm not reporting on that information at this time as that continues to evolve. So the total tests from our hospital labs for this past week are actually down about 2,000. And our range has been anywhere since the beginning of May between about 10,500 and about 15,700. So you can see this past week we're sort of right in the middle of that range. And the other important thing is that the percent positive, meaning the number of positive tests over the total number of tests that were done, has significantly decreased. If you've been following our numbers over time, it's gone down a lot, which we would expect because we're testing people in the community and we're now testing people without symptoms. So our overall percent positive of those 13,000 tests was 3.7%, although individual hospital labs ranged from 3.2 to 4.8% over the past week. Again, this does not include the private labs in our community who are also supporting testing. So those would be labs that support the pharmacies that are having testing availability, as well as the labs that many outpatient doctors' offices use that are not associated with our hospital labs. And finally, I shared this last week. This was an update to the priority testing criteria from the state of Ohio. And we talked last week about priorities 1 through 4 being those where we were focused. And priority 5 would be on the horizon. And the governor brought that into play yesterday. And so we are now testing everyone regardless of symptoms or regardless of where they fit in any of these priorities. I will say, though, that racial equity continues to be of utmost importance to this organization and to our COVID-19 response, and so we will continue to use an equity-grounded strategy for deploying our testing resources in our community, in neighborhoods, and at locations where people can access via foot and bicycle to ensure that they have testing when they would like it and when it is necessary. So at this point, the cameras can stay where they are, and I'm going to transition to my colleague, Dr. Johnny Rose, who is an MD, PhD epidemiologist and modeler who has been just an invaluable asset in our understanding of predictive modeling for the local community. And I'm really grateful that he has come and joined us today. He's in the midst of trying to write a lot of grants and still, stamp out a pandemic. So, Johnny, thank you so much for being here.
Thank you, Dr. Gully. Good morning. I'm going to present the results today of some modeling work that has been the result of a collaboration between researchers at Case Western Reserve University and University of Akron in conjunction with Cuyahoga County Board of Health. So a couple of things about this model that are important to understand before we present results. These are things that make it very relevant for understanding COVID-19 transmission in our community. First is to understand that the model accounts for asymptomatic transmission. Okay, that is transmission of the virus by people who are not showing symptoms of it. And we now understand that that is of major importance when it comes to propagating this epidemic. The second and related fact is that it accounts for the effect of isolation of people who are symptomatic. Okay, and that is an important part of the response to this epidemic, and that's why it's so important that we do this testing. And so what this allows us to do, because we use daily case counts of COVID cases to inform and update this model every day, it turns out that it's very good for tracking how we're doing at mitigation. And the metric that some of you are probably familiar with is R0. And R0 is, it's a reflection of the amount of transmission that's happening with this virus. Okay, so in simple terms, it can be thought of as a measure of how many susceptible individuals somebody who's shedding the virus is going to infect. Okay? And as you've also probably heard, an R0 of greater than 1 is required for a disease to be an epidemic, for sustained transmission in the community. Okay, so knowing that, let's look at the first slide. Give you a second to transition. Good? All right. So this first slide shows for Cuyahoga County, our communities are not. Okay? And if you'll notice, two important things. R0 took a big dive in the second half of March. And from about the third week of May, we've been below 1 with pretty good certainty. Okay? And so what does this mean? Nothing about the virus has changed. Okay? This is us. This is us who have changed our behavior, right? This is wearing masks. This is social distancing. These are all those painful measures that we've taken over the last few months. Okay? And as a good reflection of that, on the next slide, you can see where Ohio's stay-at-home order came into effect. Okay? Shortly thereafter, there was a dramatic decrease in R0. And this was not the virus changing again. This was our rate of contact in the community changing. Okay? And we can also use this model to predict, just like we would predict with a weather forecast. And so what I'm going to show you on the next slide, if you want to go ahead and move it. These are our predictions over the remainder of June. And so as you can see, this is encouraging. So we really see that we expect cases to pretty steadily decline over the remainder of the month. What do the shaded areas mean? The darker shaded areas are what we call the 50% uncertainty envelope. The lighter shaded areas that are wider, the 75% uncertainty envelope. This just reflects our confidence in these estimates. And you can see that even in a most pessimistic scenario, that we're still on the decline. Now, what does this mean? Does this mean this is a long-term trend? Definitely not. This is just taking us through the end of June, so we can't infer much beyond that. But we do feel quite confident that we are going to continue this trend for at least the next few weeks, given current social mitigation measures, right? It doesn't mean either that we can abandon those important mitigation measures. And to show you the importance of what we've been doing, on the next slide, I want to show you what would have happened without all the activity, all the sacrifices that we've all made since March. If you'll go to the next slide, this is projecting without the stay-at-home order. This is without social distancing, without masks, without quarantining, without isolation, any of those things. And look at the scale, the vertical scale on this graph. This is a logarithmic scale, so it goes up to 10,000. So these are the number of cases we would be expecting per day. And it doesn't matter what health system and what community, this is beyond the surge capacity of any health system. So what we do matters more than anything, okay? So this is a success story, okay? We've been winning a lot of battles in the war against COVID, but the war is definitely not over. Terry?
Thank you, Dr. Rose. So that's, I'll wait for people to transition here. Great, thanks. We're good? Good. I see one of our cameraman has a mask that says Cleveland against the world. I think what we're really talking about, it seems to me, is Ohio against the virus. And Dr. Rose's encouraging trends are a reminder of what we've done right to try to reduce the impact of this, devastating impact of this virus. And we'll talk a bit about that as we wrap up today and then go to questions. So I wanted to tell you today that given the current positive trends that we're seeing, we're going to share our plans to take a bit of a break from the briefings in the near future here. As events warrant, we'll reconvene to provide briefings. It's our sense that we're at a place where we can provide updates in other ways that are more efficient for all involved, including releasing periodic data briefs to continue to track our progress and our trends, which we know is very valuable to people. This has been but we want to thank everyone and take a moment to thank everyone who has followed us online over the air and has been tracking the work we're doing over the past several months, and we truly appreciate your support for the work being done here. In preparation for each update, I'm struck by the gravity of where we were and what we're doing. This has been a time unlike any other in many of our lives. I hope that we've helped to share the latest information and prevention messages, and we kept you updated about the way in which COVID-19 has impacted our area. I'm personally honored to serve as part of this response team here at CCBH, and I'm proud of the extraordinary work of our staff and our partners. As an agency, we want to offer a special thank you to our local media partners for their commitment to bringing the story to each of you each week. From our videographers who arrive early to make sure that everything is ready on time, every time, to the reporters who follow the story and find the answers. We appreciate the effort all of you have made in being here and tracking us online. We couldn't have flattened the curve and made the progress we have to date without all of you. To our friends in the county administration, your technical support for these updates have been invaluable. We thank our colleagues at the Emergency Operations Center who have worked hard to disseminate public health information and provide important personal protective equipment to protect people in a whole range of sectors. A special thanks to Executive Yudish for this collaboration and support from his entire administration and all the Health and Human Services staff that have worked so closely with us in this response in so many ways. The media crew that is here every week bringing our live stream to life on Facebook and YouTube has done a tremendous job. And I most certainly want to thank Heather, Paul, and Ben for being here to provide translation for the hearing impaired. It's an important resource. I apologize for all the times I started talking too rapidly. And I think now that we're taking a break, and we're all a bit tired, I'm perhaps talking at the right pace to make it manageable for you, so thank you. We truly could not have done this without everyone. And I think our vigilance to date has served us well. What do we know? We know that cloth masks work. And the more people that wear cloth masks, the more protected we are as a community. Remote working and staying home when you're sick works. Protecting our seniors and other vulnerable populations remains essential. As we look ahead, please continue to follow us on our website and social media outlets for the latest information, and visit coronavirus.ohio.gov to follow the guidance and recommendations from the state. The health of our economy is a contingent upon the health of our people. Continuing to follow these tried and true public health principles is the only way forward. And as we take a breath and prepare for the possibility of a fall surge that we certainly hope we can avoid. Finally, Dr. Gullett has given us her all throughout this response. We'll be forever grateful for her commitment and sacrifices. I'm grateful for the commitment and sacrifices of everyone here that's been part of this process and for everyone in our community. There's been great coordination between the medical students and preventive medicine doctors and all of our staff during a very difficult time here in the county, perhaps the most difficult time we've ever faced as a health department. As Heidi has told us many times, it's important that we're kind to each other, especially during these difficult times. I think that's when it matters most. Please remember that part of being kind and demonstrating respect for one another means it means that we must continue to follow the public health protective measures that have served us so well as we sustain our gains. In fact, it's the only way forward through the uncertainty that the future brings. So with that, I want to pause and open the floor for a few questions.
What a shocker. And Dr. Rose and Dr. Gullett have done a great job of kind of framing it. That it looks as though it's trending correctly, but we're not over. And we had I guess there's some pushback to certainly Dr. Acton resigning. I don't know if it's a result of that or not, but we've seen signs that say no masks allowed. So, aside from the fact that that's maybe irresponsible, is there a lot of pushback? And I guess what is the message that you want to send about people that are actually consciously flying in the face of this? Flying in the face of precaution and safety.
Right. So I can start if others may have comments they want to share. But I'll start off. So Vic's question was, there have been some concerns out there expressed, and perhaps some people that are have different feelings about the safety measures that have been brought forward about the use of masks and other protective measures. We understand people's freedom is important, but I think from our standpoint, the sacrifices we make are important for the collective, for the community, for the society. I think it's a demonstration of wearing masks and the idea of people now working remotely, which, by the way, I think is here to stay at some level. It's probably good for our general well-being sometimes. I also think that the guidance around really staying home when you're sick and the old adage around washing your hands means something different to everyone. So these are not new public health protective measures. They've been using masks in hospitals and surgeries as long as anybody can remember. And there's a reason for that, because it protects people. So I understand people's concerns about their freedoms, but I think the cost related to that freedom is also support of the collective society. And so we've made some sacrifices. We've made some hard sacrifices that many people will remember. And some, I would say, standing here, that I can't possibly understand those sacrifices. But when we see the models that Dr. Rose has brought forward, they're encouraging to us. People's lives have been saved. And at the end of the day, that's what this has always been about. We try to limit as much suffering as we can, as much death and as much pain as we can in this process, because the virus will continue to march on. Many of us have not been exposed. The vast majority of us have not been exposed to this virus. And so we need to continue to do what we can. And I understand people have different feelings. It's a free country. And so we would hope that most people understand that these protective measures are not meant to be draconian. They're meant to protect the health of the public. You know, we have fluoridation in our water for a reason, right? Because it helps to protect our dental health. We have seatbelt rules in society and speed limits. We have protective caps on medicine bottles to protect our children and other vulnerable people. These are all public health preventive measures. In fact, on our wall behind us, behind some of the information there, is 100 years of different things that public health has done to improve the lives of people. So I appreciate the concerns, but I hope that people appeal to their better angels and continue to recognize that isn't really about them, the mask. It's about the people that they come in contact with.
Thanks, Terry. Just to add, there are some natural experiments happening in this country, and I think we're starting to see this week some of the outcomes of those experiments in some of the states that have been slower to adopt measures and faster to abandon. Unfortunately, I think we're seeing the result of some of that. Nobody is in the business or has any interest in impinging on anyone's freedoms or rights. We are all fans of those same rights. But I think that most people in our community are going to place the health and safety of others above any sort of ideology around this, and hopefully make choices accordingly, because we can see what the alternative can be.
So Governor Mike DeWine yesterday obviously talked about everybody can get a test, right? And you guys echoed that sentiment today. How is the county gearing up for that? Do you guys have more testing sites open, you know, if and when there's a flood of people who just want to get tested? Are we ready for that?
Well, I'll answer the first part of the question, and then I'd ask Dr. Gullett to talk about some of the specifics on what's happening on the ground in some of our community-based sites. So it seems like 100 years ago, but I remember back in March when testing was hard to be found anywhere in the country, frankly. And so we've come a long way since then, and I think quite rapidly we've seen a change in the past few weeks of increased testing capacity. So what's happened? We had concerns in the past around the availability of the actual kits to test, the swabs, which early on were made in Italy, and they were amidst a huge surge. And so that meant availability of test kits, given Wuhan's use of them and the initial response there. So that was a gap. We had then a gap around the equipment to actually run the tests. We had a gap around the chemicals or reagents, as they're called, to run the actual assays to give results. And so those delays were happening all over the country. We are now in a position where we have the capacity, and it's ramping up very quickly. So what's happened? We know that hospitals are doing testing and have been, but are doing more testing for their outpatient procedures among their clients. We know that there are maps showing testing available at a range of pharmacies. Now I think 7 CVS pharmacies and a Rite Aid in Cuyahoga County alone that have drive-through doing hundreds of people every day. And we also know that the community health centers are gearing up to do testing of their clients as well. So a lot more testing available than there was just a few weeks ago. So I think it's already happening. I think that priority 5 piece opens the door now for anyone that's interested in a test. And given the momentum we have, I think we're in stride to begin to meet that. Specifically, I would defer to Dr. Gullett to talk a bit about what we're doing on the community testing side to make sure we reach people that might otherwise not have the ability to access a test.
Yeah, thank you for that really important question. So we have been working with lots of different community partners in neighborhoods across the county, including all municipalities in the county, to ensure that adequate testing is available where people can access it via walking or bike, as I mentioned earlier, or via drive-through. So we have sites set up through June and July with our community testing program in partnership with Metro Health. And we're working closely with many other community partners who are standing up neighborhood testing, such as our community health centers. So we've been meeting with them weekly for a few months, and in fact met yesterday, and they are all in various stages of unrolling their plans as well for testing. We had a community testing site yesterday, which I know some of you were at. And there were only about half the spots we had that filled, and we did have people come up on bike and come who hadn't registered, and we registered them on site and were able to give them a test. But we're seeing a much lower demand for tests than there was even just a few weeks ago. And I think probably some of that is that it's beautiful outside. We are all desperate for sunshine and our lives to return to normal. So what I have told our community partners this week is that if we can set up a structure in lots of parts of our community that enables us to be able to rapidly deploy testing when there's a surge, we will have succeeded during this time where the demand seems a little lower. And it's those very sites that we hope will be points of dispensing for vaccination as soon as it's available. So our work in the coming weeks and months is to provide testing opportunities where they're accessible, but also to prepare an infrastructure or the right partnerships in the right locations for testing with surge and for dispensing of vaccine. I mean, those are really the things I'm looking forward to. There's been a lot of criticism leveraged locally, across the state, across the nation, that models overblew the potential number of cases we have. And what we have been saying all along here is that prevention is the way through this. And so providing these testing sites and then vaccination sites is really the way that we're going to get through this. The models showed what would have happened without all the things all of you have done and continue to do. And vaccines are going to be an important part of that, as is continued widespread testing. So hopefully that helps. And we've been a little surprised about the lack of interest in testing over a few weeks. Now we have tests, nobody wants them. But hopefully we'll be here if you want one. We continue to test in our parking lot every day, by the way. Oh, right. And thank you, Terry. The other thing is that the Ohio National Guard, as you're aware, has been deployed to test across the state. And it's by zone, and so there are zone leaders in each part of the state. And so they have been testing in congregate settings, so in group homes, as where the start was here in our community, and then in nursing homes. And the number of those will be increased starting next week. And so we appreciate their partnership as well in testing people who live in congregate settings as well as employees who work in those settings. On the response side, we're ready. We have handled far more cases, as you can see from a few weeks ago, than we are right now. And so we're ready to respond should there be an increase in cases with the increased testing. But the National Guard is an important partner in this, and we appreciate the governor's support of testing.
I'm getting a text message right now. I don't know. They are asking me to ask about the state identifying 302 cases predating March, I guess. And could you guys talk about that?
Sure. So the question is about the news reports yesterday about 302 cases predating the first diagnosis, which of course occurred in our jurisdiction. The first 3 cases diagnosed the same day, beginning of March. I referenced those briefly in my earlier remarks when reviewing the data. We've known that the onset of symptoms for a number of our cases was prior to that first week of March. Our earliest symptom onset that we've identified through case interview here is February 28th, but those are for lab confirmed and probable cases. So now that we have serology or antibody testing, I know there's a lot of thought about when did this appear in various communities, and exactly how did that spread happen? And so there is a lot of work being done to understand if there were people who had infections that resembled COVID before we had PCR tests available, and could that indicate the time frame of the virus circulating here before that? So again, we don't have anything more to report on that today. We do appreciate all the incredible detective work that's been happening to really isolate when this virus first appeared. But we do know in our community, circulation was, with certainty we can say circulation was happening at the end of February. And whether it was before that or not, we're still waiting on some other information to help us understand that better.
We'll take one more question.
I have one more. Sure. This is for Mr. Budish. You talked about the diversion center. I would love to hear more about that. You said that you understand the prize of defunding the police department, but you won't have to defund the police department in order to, or partially defund or whatever in order to do this. Can you talk about how you would fund this diversion center, and maybe any more details you can give us, like a potential time when it would open, anything like that?
Sure. As I explained, the concept behind the diversion center is to provide a better place for treatment and preparing people to become productive citizens better than in a jail. Right now, the jails are the biggest mental health and addiction providers, not just in Ohio, but everywhere. And that's not where it should be happening. Clearly, some people will have to go to jail. There's no question about that. But lots of people, we believe, and the experts believe, can be diverted from the criminal justice system prior to going into the criminal justice system, which is what a lot of the discussion now in the country is all about. We, in the last budget, set aside $2.5 million in a year for the diversion program. We did that out of our regular funding. We didn't have to cut law enforcement to do that. We still don't intend to have to cut law enforcement to do that. We've come up with other sources. We also settled several of our opioid cases. We believe that we can use some of that funding to support a diversion center program. So we've been out in the community trying to raise some money for a physical facility. Rick Chiricosta from Medical Mutual has been very helpful to the county in helping us lead that effort. So we are out there trying to put together this diversion center. We have, as I mentioned, we went out already previously a week or two ago for an RFP. to see what services are out there and what currently could be provided in the nature of a diversion program. We are prepared to do that.
Thank you.
And I would hope that we can do this fairly quickly, certainly before the end of the year.
Thanks.
Thank you.